And we're back again. Dr. Dylan Greeney. I'm here to help you get your best skin. If you guys are just tuning in, we're just getting started. I hope that you guys are doing okay. I'm glad that you're here. Glad that you made it in safely. Let me know if you're hearing me okay, if things are sounding okay. Again, I'm here for you guys. So any questions you got, all you got to do is drop in the chat. I'm here for you. So thanks for being here. I love helping you guys get your best skin. So the whole goal today is to help you guys get your best skin, to answer your skincare questions, any skincare questions you got. I'm here for you and happy to help. So just drop any questions that you got in the chat. And if you guys have been here before, you know we get through thousands of questions generally. So anything you got, you can ask it. We can talk about skincare products, routines, skincare problems. I'm a board certified dermatologist, so I help people with medical dermatology, also help people with all kinds of other skin concerns. So things like cosmetics, lasers, injectables, Botox. There's pretty much nothing you can't ask me about skincare that I wouldn't be able to help you with. If you guys are just getting here, make sure to tap that like. Tap the likes, guys. That really helps us fuel up this live and make sure that everybody gets their best skin. So any questions you guys can ask, let me know if you guys can hear me okay. That'd be super helpful. Just drop a thing. Alistair, is so good to see you. Thanks for being here. I appreciate you hopping on today, Alistair. So thanks for being here. So any questions you guys got, just ask them. I'm going to be here hanging out with you guys for a while. So I wanted to get back. We had a great live yesterday. Got to answer a lot of questions. Someone asked about, I get itchy and hives when I put pressure on my skin. There's types of physical urticaria, and that's something called pressure urticaria, and it can be really frustrating. But urticaria is types of hives. What is the best way to do a skincare routine? So that's a wonderful question that can help so many of you guys that are out there. So skincare routines don't have to be complicated and they don't have to be expensive. So that's the one thing I want to tell you guys. If you guys are getting here, make sure to tap that screen, guys. Tap the screen if you guys are here and this is helping you. So if we're looking at a great skincare routine, we're going to want to wash in the morning with a gentle cleanser. I really like CeraVe Cream to Foam Cleanser. That's a wonderful one. Then you want to go with a nice vitamin C serum. I really like the one from Brandify, but you can also get, a nice vitamin C from Rock. That would be a good option. You can get one from them as well. May Love makes some really good ones too. And then a great sunscreen in the morning like LTMD UV Clear. That's a really, really good thing to include. So those are all really, really nice options. Hi there. How you doing? Filmed by her. It's good to see you. Thanks for being in the chat. If you have any questions at all filmed by her, just make sure to ask, okay? I'm doing really good, Shelly. Thank you. Thank you. Have a small bump on my nose that bleeds. That's definitely something you want to get checked out. Some of the earliest signs of skin cancer, particularly basal cell carcinoma, which is the most common type of skin cancer, is a bleeding wound that just won't heal. And we call that tissue friability. It means you barely touch it and it's so weak and gentle and delicate that it bleeds easily. So make sure to get those checked out. New moles on the face, you can get a lot of new moles all the way through age 40. So that's something that can happen. Pinky Khan, thanks for being here. It's good to see you, Pinky. So yeah, so good skincare routine. The other thing I want to throw in there on the good skincare routine is at bedtime, do a retinol like rock retinol, or if you have a little trouble with acne, I would use like La Roche-Posay. Dark lips. So one, if you're smoking, definitely stop smoking. You can do some gentle things on the lips like glycolic, like exfoliators and things like that. Those can be a good way to kind of exfoliate the lips a little bit. You don't need to scrub the lips because there's not a lot of thick skin there or anything that you're trying to get rid of. So that's the things you can kind of work on. But great question. So Tommy says, greetings from Slovakia. Thanks for being here, Tommy. I'm just stopping by to spread some love and positivity, but hit the like button. So thank you so much for helping with the algorithm. I appreciate you, Tommy. Thanks for being here. And thank you so much for tapping the like. If you guys are here, it's the best way to support the channel if you guys want to tap that screen. So thank you. Thank you. So dark lips. I want to say exfoliating wise, CosRX makes some nice lip exfoliating options that are good. Sauna, good or bad? I personally like it. Just be a little bit leery of sauna when it comes to having melasma, because melasma is mainly flared by hormones, but it can also be flared. By heat. So you got to look out a little bit for heat because that can cause you some trouble there. So how to fix hypopigmentation? So hypopigmentation is light spots. Hyperpigmentation is dark spots. Hypopigmentation actually can be a little bit more tricky to treat, and it can completely depend on what's actually causing the hypopigmentation. So there's a lot of different things that can cause it, but it just depends. Like things like vitiligo can cause permanent loss of this color of the skin, but they can be treated with things like steroids or all the steroid-free agents that can be done. Sometimes you get lightness of the skin just from mild eczema. That's called pityriasis alba. So it depends. It would be a good idea to go in, get checked, and make sure you know exactly what's going on. So other good things. Two-toned lips. Again, doing the good gentle lip exfoliators, things like that, that's going to help to even skin tone. Most of the hyperpigmentation fighting actives do help to even the skin tone. Few pimple scars, how to get rid of it. That's from Prashant Day to Day. So pimple scars are super frustrating. If they're mild, just know that pink and red pimples are going to fade away usually pretty nicely with time. There are lasers you can do for those though if it's bothering you. So that's another good thing you can try. Microneedling at home, some great devices are like the Cure microneedling system. That's a really, really nice one. And also Banish. So Banish makes a really, really nice microneedling stamping system too that can be very, very helpful for those mild scars. You can always do chemical peels in the office or things like lasers in the office that can really help a lot. Anna says, I have a small red dot on the side of my nose, never goes away. I've had photofacials to no avail. Is it capillary? So you can tell if it's blood vessels usually by, it's hard to say because most people don't have like a piece of glass, but we use like a microscope slide in the office, something called dioscopy. And it's when you push a piece of glass against that and you can look through the glass and you can see those blood vessels go away. If that makes it go away, then it's just a dilated blood vessel. Most of those red things like that can be treated with laser to put a little heat and energy into those blood vessels and allow that to fade away. So that's a great question. Amy says, my teen has a combination skin that gets very congested, spots and white blackheads. What should you get rather than fully? Also, she has some hyperpigmentation on her face. So the good news is both acne and hyperpigmentation can be treated in the same way. So if you want to, the best option you can do, Amy, for this is in the morning, you want to use a 4% benzoyl peroxide cleanser. Okay, I really like the one from CeraVe, but also Panoxyl makes a really nice one. Also, Acne Free makes a nice one. It ranges anywhere from 2.5 to 4%, but either of those would be great. Those are really, really good options. So I would look into doing something like that in the morning and then at bedtime. And Pinky Con, you're going to want to listen to this because this is for you too. We're talking pimples and acne right now. So a 4 or 5% benzoyl peroxide cleanser in the morning, then La Roche-Posay epichlorohydropiline gel at bedtime. That's something that used to be prescription only. Now you can get it over the counter. So that's a really, really good option. Can you guys comment? Is the volume okay for you guys? Can you guys give me the thumbs up or just say yes in the chat if that's helping you guys? Drop some comments in the chat, guys. If this is helping you, I need to know it. I want to know that this is helping you and you guys enjoy this. So feel free to drop that in the chat and let me know if you can hear me, okay? So we just been talking, so too low. Hannah says too low. That's what I was a little bit worried about. Trying to turn it up a little bit here. Hopefully that's up some. Let me see if I can also adjust this mic a little bit because I was worried that I was a little bit too low for you guys. I can boost this up a little bit for you guys. I just want to make this a little bit more. So let's try that. See if that boosts it up a little bit more. Hopefully that's better. Alistair says it's perfect. If it's, I hope it's not too loud now, but let me know if it is. So thank you so much. So best treatment for acne vulgaris. Let's run through it real quick one more time. 4 or 5% benzoyl peroxide in the morning, and then at bedtime, La Roche-Posay adapalene gel at night. So I kind of do that. Thank you so much, CMB Tiger. CMB Tiger in the chat is my lovely wife. I love you so much. So thank you so much for checking in. Pinky Man, you're welcome. Happy to help with the suggestions. Can you suggest a permanent solution for pimples on the face? So the only permanent solution for pimples on the face is either you treat it and you keep treating it to keep it gone, or you treat it until the point that you grow out of it, or you get on Accutane. So Accutane, like isotretinoin, Accutane, that's the only permanent cure that there is for acne overall. So that's something so that you can do that. Remedy for toenail fungus, guys. If you guys are having toenail fungus, it's a tough thing to treat. Even if you do the most aggressive treatments, even if you don't do the most aggressive treatments, the cure rate's probably still only about 60%. And the recurrence rate of that fungus is probably 30 to 40%. So it's a high chance of coming back. Sometimes doing topical antifungals like once a week or something to keep it gone, that can help. But it is really, really frustrating. Small acne in different positions on the scalp and hair starting to fall out. So Vet UG, that's a good question. If you're getting bumps on the scalp, this is something I pretty commonly see in my patients. Areas where you have a lot of hair like that, very common to get folliculitis. There's a really, really great shampoo called CLN. CLN shampoo is great. So that's a really, really nice option that you can do. What products you use for ringworm? You can get terbinafine over the counter. Terbinafine over the counter is a very effective treatment for ringworm. You can also probably find 1% ketoconazole over the counter, and that's another option that you can do. Seborrheic dermatitis on the face. So seborrheic dermatitis on the face, I like mild hydrocortisone, like a 1% hydrocortisone, also ketoconazole, very good for it. Same thing with, it's technically a type of fungus. It's a type of yeast. Malassezia furfur is what causes that seborrheic dermatitis, that's almost like an, you can think of it almost like a dandruff of the face. That's something that can happen in the face. And, the ketoconazole and hydrocortisone, those are things that can help with that. So let's see. Dr. Ab, dry skin with comedal open acne using adapalene, and after using that, getting pimples. So chemistry by Prashani. So I don't know what you're like, how long you've been using things, but I'll say this. You have to continue using those things for at least 3 months to really start to see the difference. You're not going to notice any improvement in an acne routine for at least at the bare minimum of 6 weeks, but usually around 8 weeks to 12 weeks, because you have to stop preventing pimples from the very beginning. Because if you're not preventing the pimples in the first place, then you're always going to get more pimples coming up. You have to stop that very first kind of root cause of acne, which is the blockage of the pore, which leads to oil buildup and inflammation behind the pore due to bacteria on our skin. So it takes a while to get that under control. Alistair says, is it okay to use retinol after using a product with salicylic acid? Some products even they include both retinol and salicylic acid at appropriate concentrations. The worry that people will say, Alistair, is that if you use these things together, both can be irritating. And if they're both irritating, then, it can get your skin very upset and very irritated. It can damage your skin barrier. Now, if you're using a product with both in it, you're in pretty good shape because they probably formulated those products to both be mild and both concentrations of the products. Thank you so much. Thanks, Doc. Appreciate it. So they've essentially done it. So they formulated it where they're both really reasonable to use. So, you can use them together, but just know you might be a little bit more likely to get irritation. Okay, so that's the thing you want to do. Hair fall product, I can't use ketoconazole. The best thing for hair fall that there is over the counter is actually minoxidil, 5%. You can use that once daily as a woman, twice a daily as a man, and that's the best way to regrow hair. Now, it does take about 3 or 4 months to start working. I think you see a trend here. The trend will be essentially that most of these things take time to work. But so many of our skincare problems and things like that, they take time to form, right? So there's not going to be a super quick fix for them either. So little red nodules on the lower cheek of the gluteus. It's tough saying. Very common area for folliculitis. CLN body wash is good. You can also use a good cleanser like benzoyl peroxide 10%. Those are good options. Small bumps on the forehead, not itchy, no redness. What should I do? Most of the times that little skin texture is just little clogged pores. And I would end up leaning into using things like salicylic acid cleansers, Inky List 2% salicylic acid cleanser. Use things like adapalene gel. These are good options to help do that. Stubborn KP. So KP, for those of you guys don't know, it's a question you guys ask about all the time, but on the backs of the arms, you guys get the little bumps on the backs of the arms here, or maybe on the front of your thighs. That's called keratospilaris KP. Some people call it chicken skin. And the best treatment really that I know for that would be amlactin. So amlactin is a really, really great chemical exfoliant that has lactic acid in it. And lactic acid gently chemically exfoliates without the scrubbing. You don't need to scrub the skin to kind of get the good, the good improvement there. You just got to be patient with it. And then I had a question over here from, would Doc ask a question? Let me see here. Seborrheic dermatitis. Anything that can permanently cure it. So unfortunately, there's not a permanent cure for seborrheic dermatitis. Again, if you guys are asking about dandruff, seborrheic dermatitis, this is kind of the same. This is in the same spectrum. So listen up. So seborrheic dermatitis is kind of like dandruff of the face, and it's caused partially by a yeast that lives in our skin, but all of our skin reacts a little different to that yeast. Some people get pretty rashy. It usually shows up on the face, particularly in the oily areas like our smile lines around our nose, sometimes between our eyebrows or in our eyebrows. And then for guys that grow beards, sometimes they come up under the beard. So again, using a ketoconazole shampoo, like a 1% ketoconazole shampoo, Nizoral, on the face, that's a good way to kind of control that yeast. But sometimes that doesn't completely do it for people, and you got to also use a little bit of a mild anti-inflammatory like hydrocortisone. That's a good way to do that. Salicylic acid face wash and dry skin. The trouble with that is salicylic acid, of course, can be a little bit drying. It's oil soluble. It's a beta hydroxy acid, so it gets down into oil glands. That's why it helps so much for preventing blockage and block up in the pores. But so that part of it's good. But the thing that you have to worry about is sometimes it's a little too strong. So one of my favorite products with salicylic acid that's a very mild strength is actually using a 0.5% salicylic acid. And Vichy makes one. It's got a big long name, but it's called Vichy Normaderm Phytoaction, and it's one of my favorite cleansers ever. Right now, my morning and night skincare routine, I pretty much am going to use, I wake up in the morning. I use usually either one of two cleansers. I end up using either the Rock Barrier Renew Cleanser, or I'll use La Roche-Posay Tolerian Foaming Facial Cleanser. Then I apply a vitamin C serum in the morning. I've been using one of two different sunscreens that are both tinted and hybrid. I use either Brandify sunscreen, or I use Peter Thomas Roth, I think it's called Water Drench tinted sunscreen. And then that's my morning routine. That's all I do. And then at night, right now I'm using a prescription retinoid called Araslo. And then I'm using a serum from Lancome as well. So that's what I'm doing right now. I'd have to get the serum name. I'd have to get the serum name for you, and then every now and again, I'll hit it. I got the mineral sprays here, like this La Roche-Posay one. So this is the La Roche-Posay thermal spray, which is pretty cool. If you guys haven't seen thermal spring water before, it gives you a nice dewy look. It hydrates your skin really nicely. So that's what I do. Why do armpits darken and how to treat? So sometimes certain areas of our bodies just have more melanocytes, but you got to look out, Alistair, because if you're getting like the dark skin on the neck, or you're getting dark armpits, there's a condition called acanthosis nigricans. And acanthosis nigricans can actually be a sign of like insulin resistance and metabolic kind of disease. So things like type 2 diabetes or PCOS. So you want to make sure you're staying a good, healthy weight, make sure you're exercising regularly and eating a good, healthy diet. Because if you start to get a little insulin resistant, when your body ramps up insulin production, it's a growth factor in the body and it can damage our skin too. And that sometimes can be, like your skin is kind of like the window into your whole body, right? Everything's connected in our systems. So that's a way to tell that. So just so you know. Tips for vitiligo. If you have vitiligo all over, light therapy in the office with narrowband UVB light therapy can help. It doesn't really increase the risk of skin cancer. Obviously, you do have to worry about UV light, but when you get full spectrum UVB and UVA, that's when you really ramp the skin cancer up. Narrowband UVB can help treat vitiligo without increasing the risk of skin cancer drastically. So the thermal spray is a nice touch. I would say it's not like the first thing I'd buy for a skincare routine, but it is a really nice touch that you can do. It's a nice thing to add into a skincare routine. It's the first step of a skincare routine, and then you can do other products on top of it. If you guys don't know how to do a skincare routine, I always kind of tell you guys, work thinnest to thickest. If you work thinnest to thickest, that's the best way to do it, to kind of get, you basically ensure everything absorbs well, and you can kind of get the best results. So what else here? I haven't tried Indian skincare products. A lot of people ask me about Korean skincare and stuff. I haven't really tried any Indian skincare products, but I'd love to. Skincare for oily skin with hyperpigmentation. Really, you got to get active hyperpigmentation ingredients. I think one of the best treatments right now for hyperpigmentation, not 100% sure where all it's available in the world, but I would look into getting, it's called Remedy for Dark Spots. So very, very, very practical name, Remedy for Dark Spots. That's a great one to fade hyperpigmentation. It's got about like 6 or 8 hyperpigmentation fighting ingredients within it. And then you want to also wear sunscreen, because obviously the more your skin is exposed to sun, the more likely darkness you're going to develop in your skin. So you definitely want to look out for that. I want to say, guys, if you're here, Dr. Dylan Greeney, I'm a board certified dermatologist. I'm here to help you get your best skin. Okay. So I'm here for you. If you guys don't subscribe, make sure to subscribe so you get the live, so you get notified. Tap the bell, subscribe if you guys are here. I'm so happy to see you guys in the live chat today. You guys are obviously asking great questions. So feel free to subscribe. Make sure to tap the like too. The more comments you drop, the more likes you tap. That really helps lets YouTube know that you guys are, lets YouTube know that you guys care and this is helping you guys. So I really, really appreciate it, guys. Thank you so much. So I appreciate you guys being here. Pinky Khan says, suggest me a face wash. So if you guys don't know, here on YouTube, I do have full length videos for the best skincare routine. I literally have a recent video called Get the Best Skin of Your Life Without Breaking the Bank. Okay, I've got that. I've got the cheapest skincare routines. I've got skincare routines for dark spots. I have all of that there. So if you're wondering, like, hey, what's a good face wash? If you go to that routine video, I've got one for oily skin. I got one for sensitive skin. I got all of those things. But Pinky, I'll say this. If you're looking for a great cleanser overall, I would say go with either Rock Barrier Renew Cleanser or go with CeraVe Cream to Foam Cleanser. It's going to give you a nice lather. You're going to feel super clean, and it's not going to strip your skin. Feels really, really good. So I just want to say, Hunter, thank you so much for subscribing, Hunter. I really appreciate it. Thank you, Hunter. I appreciate you. Thank you so much. So let's see how to treat dark elbows. So dark elbows, again, that's caused from thickened skin. So thickened skin on the body. So that thickened skin on the body, you want to thin that out, but not with scrubbing, because honestly, if you scrub your skin, you can get something called lichenification, which is the thickening of the skin that can happen as a response to excessive rubbing. It's called lichenification. So you want to use good, like, exfoliating moisturizers like amlactin. It has lactic acid in it. It's going to gently exfoliate away some of that thickened skin. It's going to lighten the elbows. It's going to make them feel more hydrated, soft, and pliable. Thank you guys so much. I appreciate the gifts. I appreciate the subscribe. Thank you guys so much. You guys are amazing. So dark knees, you can do the exact same thing. Can we break out if we over moisturize? I would say no. So I would say you won't really break out if you over moisturize, but if you're using a bad moisturizer that's like loaded with oils, or it's comedogenic, which is basically what comedogenic means. It means it can block the pores. And how they study that is they'll actually take, hey, we're developing a product, right? We're developing a product and we're going to test it on 100 people. We're going to look at how many pimples they have when we test it on them. And then we're going to look at them after they use the product for 4 weeks and see how they're breaking out. Do they have more pimples at that time? And then they can say a product is comedogenic or not, because do they have more bumps in their face? So that's a way that can be done. The question is, V-beam, does it cause fat loss? With 3 millisecond, 6.5 joule, and 10 millimeter parameters twice? Please help me. So Sophia, absolutely not. You don't have to worry at all about V-beam causing fat loss. You don't have to worry a bit at all. It's a great treatment, particularly for decreasing blood vessels or redness on the face. Sophia, that's a wonderful question. I appreciate you guys. Make sure, guys, to tap the like, guys. If you guys are here on YouTube, tap the like, guys. Tap the like, guys. I want to help you guys. I'm here for you. I love helping you guys get your best skin. Again, I love telling you guys skincare products that are easy to get, that are safe, that are not going to break the bank. And I can't tell you how much I appreciate you. If you want to subscribe, please do. Click that subscribe button, because I'm here for you. I want you to be part of our Skincare Bestie community. And then you can ask questions at any time, of course, in the comments. I try to answer literally every comment that comes through. So I'm here for you guys. And again, I'm a board certified dermatologist. It takes a while to become one. It takes about 12 years of training. You got to be at your top of your class to help to get into derm and everything. So I'm here for you guys, though. So thank you so much for being here, and great questions today so far. It's great to see my my Indian in this live. Hey, I'm happy to be here. I'm happy to be here. I'm in the U.S. I'm in Indiana. So I'm in Indiana, Southern Indiana. So thanks for being here. So I was told to try OTC acne gels, but not working. Was told my only other option is Accutane. Any other ideas? Well, there's a million things you can do between topical gels over the counter and Accutane. A lot of other people will do topicals like Winlevi. Winlevi is a really nice one. And that one is a treatment that helps to regulate hormones in the skin to reduce acne. You can do oral antibiotic treatment. You can do other antibiotic cleansers. You can do leave-on toners with salicylic acid. But sometimes if acne is bad, it's nodulocystic, it's scarring, they're deep, they're painful, they're leaving scars. If that is happening to you, it's not a bad idea to talk about Accutane with your doctor, because if you can shut down that process, Accutane's the only medicine that can cure acne permanently, and it can be a huge godsend to people. And Alistair, she says, we appreciate you sharing your knowledge, Doc. Alistair, I'm so happy that you guys are here, and I love helping you guys get your best skin. Doing lives is literally my favorite thing to do, because I always tell people I can only reach about maybe 30, 35 patients a day in the office, but literally on social media, I reach over 500,000 people. And I'm so thankful to be able to have that voice to help more people get their best skin. So thank you so much. Acne is worse in my 30s than when I was a teen. I feel like everything, and I'm trying to get pregnant, which is why Accutane scares me. So yeah, you pretty much can't be on almost any acne medicines if you're actually trying to conceive or you're pregnant. So that's one of the things. And you definitely can't be on Accutane. In fact, you have to be on a couple forms of birth control if you're going to be on Accutane, and you can't try to conceive for a month after you get off Accutane. After that, it does not affect your fertility and you can conceive like normal. But so Nishru, I missed your text. I'm sorry. I wanted to know when I was in my teenage, my skin was bright, but now everything is just looking dull. What should I do to get my full body brightness back, and how much time will it take? So a great skincare routine is incredibly important in getting your best skin. Okay. One, you gotta use good antioxidants on your skin like vitamin C. Okay, you got to be using sunscreen every day because the sun takes a toll on your skin. You can look at a lot of my before and afters, my cosmetic patients, and after a little laser resurfacing and get rid of some of that sun damage, your skin is so much more vibrant and alive, and it just got good blood flow. Just looks so much better, but it can get so dull and dry and lose its reflection, and that's one of the reasons the skin looks old. So you can certainly do things like lasers, but just a great skincare routine is the key. Good vitamin C, good sunscreen, maybe using a little bit of exfoliating acids like glycolic acid, and then also using adapalene at bedtime. These are great ways to help, to help get your best skin. So I would look into that. Moisturizer for normal skin. One of my favorite ones ever is CeraVe moisturizing lotion in the pump jar. It's very good. Acne marks are not going away. What to do? Things like microneedling, lasers, peels in the office, good skincare routine like we just talked about. All of those things are going to make acne look better with time. So that's really good. So Dylan says, can you give advice for getting rid of mitigating a 14-year-old periungual wart? So yeah, periungual warts are really tough because sometimes depending on where they're at, if they're, under the nail, they can obviously very tender to treat. Those are warts. So warts are caused by a virus. They're caused by the HPV virus, human papilloma virus, and they can come up anywhere. Now there's a lot of us have heard from like STI screening and stuff like that about HPV, but there's a lot of types of warts in HPV that just causes like hand, feet warts, stuff like that. They're harmless, but it is not recorded, Tegan. Good question though. So it is not recorded. So, but periungual warts can happen on the around the fingers and stuff like that. So there's a lot of different approaches. A lot of times the most common thing is treating it with liquid nitrogen. If it is around this base of the nail here, that's something called the nail matrix. And if you damage that, it can affect your nail growth. So your nail growth can be affected. And if that happens, then, it can be permanently disfiguring to your nail. One of the ways sometimes I like to treat warts around the nail, it does hurt, but you can actually inject a yeast antigen called Candida in it. And that can stimulate your immune system to fight the wart off. So that's something I like to do. Grace is going to school for Derm PA. Very good. Congratulations on getting into PA school. Dermatology is, one of the most sought after specialties in being a mid-level. So I wish you the best and just study hard. People in the derm field generally some of the brightest and best. So derm is definitely the best field in medicine. Obviously, I'm a little bit biased because I'm a dermatologist. And I sunk my whole life into training, all my 20s and my early 30s. So sunscreen safe in pregnancy. If you guys are pregnant, I did a cool video on this with my wife. But in generally, if you're trying to use, like my wife and I, we use chemical sunscreens throughout pregnancy. But if you're wanting to be absolutely safe, then I would lean into using a mineral-based sunscreen. Something like I would use like a zinc or titanium dioxide sunscreen. These are minerals that sit on the top of the skin. They're not chemicals that absorb into our skin, and that would be a good thing to do. Some people, so Lai was asking using Neosporin or not. I do not recommend using Neosporin. I'll tell you what, it's not that great of an antibiotic. A lot of people are allergic to it. I think it's probably 1 in 10 people are. In dermatology, we never use Neosporin. We almost put Vaseline on everything. And if we're going to treat an infection, we usually treat with oral antibiotics, or we'll do a prescription topical antibiotic that's less likely to cause allergy. They've actually studied antibiotics a ton in derm surgery. Obviously, as a dermatologist, I do surgery every day, removing skin cancers and helping to heal cancer. So we never use any topical antibiotics. We end up using Vaseline, just because when they study people that use Neosporin and Vaseline together, the people that used Vaseline only had the same rate of infection as the people that used Neosporin. But unfortunately, the people that used Neosporin had a lot of allergic reactions. So blisters, itching, that kind of thing. So let's see here. I have tumid lupus. How much sun do I need to avoid? So ideally with tumid lupus, that's a deeper lupus in the skin. If you have connective tissue disease or autoimmune disease, one of the biggest flaring agents for that is actually sun. So you want to definitely avoid that at all costs, because that can cause you a lot of trouble. So I see. Let's see. So do you have any recs for HS flare-ups? Especially in the intimate areas. So that's where, unfortunately, that HS likes to show up. It likes the groin, under the breast, the armpits, all those things. It can really, really be a problem. So I like CLN body wash just to reduce the inflammatory bacteria on the skin. but there's a lot of ways to treat it in the doctor's office. Sometimes I inject those. So, Nady girl, so we've been on live for about 30 minutes. Everybody can hear me. Maybe turn your mic up. I'm sweaty guy. Can you help me, especially in summer? So you can take some medicines that can help reduce sweating all over the body, but it does make you more prone to overheating. So things like glycopyrrolate is a pill you can take. Sometimes if it's just the pits or the hands, you can do different types of things like Qbrexza wipes on it. You can inject Botox in your armpits. There's a lot of different ways. So those are different ways to do it. But yeah, dry sol, Grace says, and she's right about that. And then let's see. Does neurofibromatosis cause purple spots on the skin? They're thin and squishy. Yes, it absolutely can. So you can get neurofibromas. You can get plexiform neurofibromas, which are like really thick. They feel like a bag of worms under the skin. Or you can get just like rubbery bumps on the skin. So that definitely can happen. So Dylan Brown says, I got the periungual wart when I was around 10 and now I'm 24. I've had it cut out, done the acid. It sucks living with it. Yeah, so Dylan, that's actually pretty rare to keep a wart that long. Honestly, the average wart only lasts about 2 years in most people. So that's actually pretty rare to have it that long. But you can also, there's some really good prescription treatments that you can get from your dermatologist, like a mix of Effudex and salicylic acid that's quite strong. That's something that I've done. I've had a couple like plantar warts on the bottom of the feet that really are no fun. And, but I treat it with that. So Phoebe's been on Accutane for 3 months. My acne is worse than ever. I think you were here yesterday, Phoebe. So it's good to see you again. Or maybe you ask a comment on my live vertical live from yesterday. And I just got on prednisone because of it. So yeah, sometimes when you're getting on Accutane, sometimes we'll give people prednisone to prevent the flare of acne that they have. It's usually people with bad acne, Phoebe. Most people with mild acne or moderate acne that get on Accutane don't have that problem. But there's some people when it's really, really bad, we'll put them on prednisone because of that. So Cherry, hemangioma on my lip, excised. Oh gosh. Ian, the chance that it comes back is basically zero, but you can have that treated with a laser without any cutting. So I'm sorry that you had that cherry angioma excised on your lip. Usually you can treat it with a laser and it makes a huge difference for people. Home LED mask, just me. Those are great, but they're the cherry on top. Make sure you use a good skincare routine. You can find those like in my bio and description. You can find links to some of my favorite skincare products. So make sure to check that out. If you're doing a great skincare routine and you're sticking with it, then go ahead and add the mask in, but don't do it before that. Let's see. Zoe, are you still here? It's okay. You don't have to worry about spamming Zoe. So Zoe, I want to tell you this. Zoe said, I have a spot of eczema on the hand and it's been there for a long, long time and you've been to your doctor. So there's a lot of different things that can cause a patch like that on the hand. Okay. Psoriasis can do it. Eczema can do it. You can also have fungal infection of your hand. So those all can cause that. There's other things too, but those are probably the most common things. Unfortunately, things like eczema and psoriasis are both chronic. So you can treat it, and if you stop, sometimes it'll come back. But the one thing I definitely want to do is make sure to go in, and if it's scaly, have them scrape it, dissolve that little skin flakes under the microscope, and look for fungus. And make sure there's not a fungus there, because a fungus is very easy to treat, and once you treat it, it stays gone forever. So I would definitely get that checked out. And then the other thing that you can do is, if it's psoriasis or eczema, they're generally treated in the same way, especially if it's just one spot. Usually it's going to be topical steroids. And for most of my patients, they'll end up treating it with topical steroids a couple times a day until it's better. They'll go to nightly, and then they'll go to about 3 times a week to keep it gone. But it's unfortunate that some of these conditions are chronic. And I think it's a great question, Zoe. And I hate that you've suffered with it that long, but make sure to see a dermatologist, even better than any, like a primary care doctor or anything like that. Because, we're experts in the hair, skin, and nails. If you guys don't know, dermatologists treat over 3,000 conditions of the hair, skin, and nails. So we're here for you guys. We're specialists in everything. We can usually look at something out of almost our peripheral vision and know what it is. A lot of times looking at it is the most important thing for us to like figure it out. But sometimes we can do simple tests like that to kind of figure things out. So I just want to tell you guys, I'm here for you. I'm Dr. Dylan Greeney. I'm a board certified dermatologist. I'm here to get your best skin. So I love helping you guys get your best skin with affordable products that are easy to use, that you can find easily, in the stores. I don't like expensive skincare products or anything like that. If you identify with that, if you like doing these lives, go ahead and tap the subscribe, guys. tap the subscribe right now. Make sure notifications are on. So that way, when I go live, you can get on these lives and you can learn. And you can learn from this community too, because a lot of you guys out there have become skin experts yourself. The skincare besties are quite peak in what they know. You guys know a lot of stuff. Alistair says, does working out increase the likelihood of getting acne? I would say no. Things like football, you're wearing helmets, you're sweating a lot. Sure, it can. You do want to, wash that sweat off your face as soon as you possibly can when you're done working out. But honestly, we don't move enough. We don't exercise enough. The most important thing, you guys got to eat healthy. You got to stay moving, stay active, protect your skin from the sun. You can get out in the sun, enjoy yourself, but make sure you're protecting your skin. Okay. Use sun protective clothing, use some sunscreen, get out there, breathe, move, experience life, but stay healthy, stay moving. Ian, will an excision on your lip scar? Any cut on our body will scar, but the lip does heal better than almost anywhere else in the body. So I sure hope you heal up great. Take good care of it and do that. So I appreciate you guys. Tap the subscribe, guys. If you guys are here, tap the subscribe. If I did not get your question, ask it in my most recent video. Just ask in my most recent video. I'm going to go there and I'm answer it. So right now, tap the follow. If you guys don't already, tap the subscribe if you don't already, and I'll be back. I appreciate you guys being here. I'm Dr. Dylan Greeney. I'm a board certified dermatologist. I'm here to help you get your best skin. I'm going to go ahead and shut this down. Thank you guys so much. Thanks for subscribing, Just Me. You guys are amazing. I appreciate all of you. You guys rock. Ian, thank you. Just Me, thank you. You guys are incredible. You guys have a good day. Zoe, I hope that helped you. You guys take care, okay? I'm going to shut